My name's Mark Hanson, and I had the honour of leading the FIGO group that prepared the guidelines on adolescent preconception and maternal nutrition. And I hope that you've all got in front of you a copy of the paper that is published in the International Journal of Gynecology and Obstetrics. It's also on your memory sticks for the conference. And of course, I must thank the team who, between us, compiled these these guidelines. You'll be hearing from some of them, and Abbott Nutrition, who gave us some funding that made it possible to undertake these guidelines. Why does this period of the life course and nutrition in particular matter so much? If you look at this slide, published in the Lancet, excuse me, a couple of years ago, it shows the attributable deaths in under fives in relation to undernutrition. It's actually quite difficult to point from up here because the screen is almost parallel to where I am. But if you look at this first column here, you can see that the attributable deaths to a whole range of causes, from fetal growth restriction, stunting, underweight, wasting, and then some specific deficiencies, zinc deficiency, vitamin A, and so on, add up to more than 1.5 million deaths. And if you then have the joint effects of fetal growth restriction and suboptimal breastfeeding, you're up to an even larger number. And putting the joint effects of all these things together in the bottom column here, we're down to over 3 million deaths in under fives a year. That's 45% effectively of global deaths in this age group. Nearly half of the children dying under 5 die from causes that are related in some way to impaired nutrition in them or in their mothers. This is just dreadful, isn't it? And something has to be done about it. The incidence of deaths in this age group has halved over the last 10 to 15 years. The Millennium Development Goals have been very successful in that respect, but we are clearly not there yet. That's the children. What about their mothers? Excuse me. If we look at the global burden of maternal deaths, and this data is from WHO and it's up to 2013, we can see the different causes. We've got at the top there abortion, embolism, hemorrhage, hypertension, sepsis, some direct causes, and this great big blue bar here, which is indirect causes. Well, what are those? What causes are accounting for so much more than 25% of maternal deaths globally? Well, it's partly due to infections, HIV and malaria, but it's also due to diabetes and obesity. These should be preventable causes of death. They're tragedies for the woman, of course, but they're also tragedies for their families. And once again, one can imagine that there's a nutritional component to this. Hence, part of the reason for FIGO sponsoring this group to produce the guidelines. And as you'll see in the guidelines, there's a picture rather like this, which shows how chronic disease risk increases in a non-linear way throughout the life course. And ideally, we would like people throughout the world to follow a low-risk trajectory throughout their lives rather than a high-risk trajectory. To do that, clearly, we need to start in early life. We need actually to start before conception and in fetal life, pregnancy, and then through into breastfeeding. So that involves the mother in her preconception environment, and actually the father too, because we mustn't forget the men in this story. It should be followed through into infancy and childhood, and then into adolescence and adulthood. And of course, you can see that if you think of the reproductive life of the woman herself, there's an opportunity here in promoting her health, not only to make her future life healthier, but to feed back good health to the next generation. Is it really true, though, that early life does set the risk for later disease? Does it actually amplify the effects of later risk factors? Surely the problems of obesity and diabetes and non-communicable disease are just due to the things that we do to ourselves as adults, aren't they? And there's some truth in that. But this slide, which in a sense is like the last one, except that it's been flipped through, seen, if you like, through 180 degrees in reverse, shows just how powerful that amplification can be. It was published in the BMJ this year. It's looking in adults at a score of unhealthy lifestyle where BMI, smoking, poor nutrition, alcohol use, abuse and so on are of course those risk factors, and showing that just for type 2 diabetes, as those risk factors stack up, of course the risk of diabetes in terms of its relative incidence increases. But what the authors have done is to add on to this different categories of birth weight shown by the symbols here. And you can see that for each of the adult risk factor settings, the effect of reduced birth weight amplifies the risk, and it amplifies it more and more the more the adult risk factors stack up. So there genuinely is this interaction between early environments setting up the developmental course of an individual and the way that they will respond to, if you like, the obesogenic environment, the challenges that they'll meet later on, and hence, of course, how they'll pass that risk on to the next generation. We'd urge you to look at the guidelines, to use them in talking to your colleagues and thinking about how they impact on your professional lives. They're structured to give some detailed text and some diagrams, but also to have some boxes highlighted in blue, which give a take-home message, if you like. And here's one. FIGO recommends the promotion of a varied and healthy diet as the first step to meeting the nutrient needs of adolescent girls and women, with the provision of supplements or fortified foods when necessary. Sometimes it's necessary, sometimes that's only part of the story. Just giving a pill with a supplement is not always the answer. And you can see some of the important text here, which raises the issue of what we mean by poor nutrition, by malnutrition. The recommendations view malnutrition as poor nutrition in all its forms, both from deficient energy and protein undernutrition or excess, often leading to obesity, consumption of macronutrients, ranging from that to micronutrient malnutrition, which results from a diet with insufficient vitamin or mineral density, poor bioavailability of nutrients, or increased body requirements. So the balance between what on the supply side is provided in the diet and what the body needs, recognizing that this may change with infection or during a period of growth, for example, the adolescent girl. And here's another punchline. It's important to stress that malnutrition can result from overconsumption of non-nutritive calories, so it's quality and not quantity that matters. And I think not all of our colleagues, let alone the general public and our patients, understand that. There are some examples, of course, of specific micronutrient deficiencies. I'm not going to go through them in detail. Iron is a huge problem, especially in relation to blood loss through menstruation or indeed at childbirth. Iodine is an increasing problem that we focused on because more and more people do not use iodized salt as a source. Folic acid is still a major concern associated with a whole range of congenital and other abnormalities. The balance between folate and vitamin B12 is a particular concern, especially in countries like India with vegetarian diets. Calcium is lacking in many diets, low in dairy products, and vitamin D, even in a sunny environment like this, one can bet that many women in Vancouver and certainly many other parts of the world are actually vitamin D deficient. So the FIGO recommendations aim to address several issues relating to nutrition at this time in the life course, and it calls for increased awareness of the impact of women's nutrition on their health and that of future generations. Awareness by whom? Well, by the women themselves, by healthcare professionals, by those who influence health policy, governments, funding agencies, and so on. This needs to be a global movement. It may be a medical problem, but the solution is going to be a broader social one. We need greater attention to the links between poor nutrition and the increased risk of later non-communicable diseases. The NCDs weren't even there in the Millennium Development Goals. Astonishing, isn't it? They were not mentioned, but they are there, threading their way all the way through the Sustainable Development Goals, which were supported and have been launched at the UN General Assembly in New York last weekend. So this is very, very topical. Our focus is on improving nutrition among adolescent girls and women of reproductive age, quite a broad spectrum, which of course involves not just providing the nutrition for them, but helping them to understand why this is important, educating them, but particularly in this time in the life course. And that requires not just giving them the information, but empowering them actually to use it. Quite a big issue in some cultures. And this has to be seen linked to the services, the clinical services that are provided in relation to health and reproductive care, to preconception and antenatal care, to adolescent care, bringing this all together into a package that will genuinely develop better nutrition for adolescents in the preconception period and women of reproductive age. That's our challenge, and I think it's up to us to somehow rise to it to make this a reality. Thank you very much. I'm going to pass on now to the next speaker, Professor Emily Okun from Harvard in the USA. We will have time for questions and comments after we've had 3 or 4 talks, I think, but if you're happy with that, I'd like to keep the agenda moving on.